This video is for basic facial, and so we start our video as we always would. Upon arriving to work, we would wash our hands. So we go to the sink, wet our hands, find a coin-sized amount of liquid hand soap, wash our hands together down to the wrists. We would wash the back of the hands down to the wrist. We would wash the fingers, and we would wash the backs of our fingers. We would wash our fingertips and our nails. We would wash between our fingers and our thumbs. We would wash our thumbs. We would wash our wrists. And we would do all of that interlocking washing for a minimum of 20 to 30 seconds. And when we feel like we've gotten a good wash, we would rinse thoroughly underneath the sink, also getting that really good thorough rinse. Then when we're done rinsing, we're going to grab either a towel or disposable paper towels. We're going to turn the faucet off with the towels, dry our hands completely, and then if they're paper towels, we're going to toss them in the trash. If it was a towel, it would then go into a closed container until time to do the laundry. Then we get our hand sanitizer that is 70% ethyl alcohol, and we sanitize our hands. And then we would need to go ahead and prepare the space for our client who is coming in for the basic facial. So let's talk about what we need to do before the client arrives. And of course, we want to do as much as we can before the client arrives in order to be respectful of her timeline, scheduled time, our timeline. We have a full day and calendar, and we just want to be as professional as possible. So you want to have as little left to do once that client arrives, so you can get right to that service. So the first thing we're going to do is disinfect our workstation, bed, and equipment using a disinfectant wipe, and of course following manufacturer's instructions. We're going to check all equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service, storing in a clean closed container. We'll turn on the hot cabbie and stop with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. We'll fill a clean steamer glass with distilled water and preheat the steamer. We're going to dispense products needed for the service according to the skin type and client's needs as follows. We'll prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray. Or we can remove the product with a disinfected or clean single-use spatula. We'll close the lid to the product and set the portion cup tray on the tray. We're going to drape our facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. We'll place clean, laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. We'll lay a hairnet and headband on top of the first towel, along with a roll towel to support the head and neck of the client. We'll save the third towel to lay across the client's décolleté. So anticipating that we've done all of that, we also of course have our tray set up, and we're just going to review what I have already put on my tray over here. So I have toner, I have 4 squares 2x2s, cotton rounds, of course I have water, I've got astringent in case we're going to be doing any extractions, I've got cleanser, I've got an exfoliant, I've got a mask, I have a brush to apply the mask, I have massage product, I have eye cream and moisturizer, of course. I have gloves, disposable gloves, because if we do perform extractions, we're going to need that. And then I also have some wooden stick Q-tips for extractions. And then I have disposable single-use item scoopers for product. Now this client is an existing client and I kind of know the service, but maybe you don't know the client, so maybe you're not clear on the skin type. You can at least have everything else out ready to go, everything pre-done, so that all you have to do once you do that client consultation is then either dispense the products that you're going to use according to skin type, or have right there ready so that you'll be able to dispense during the service. So that's basically what you need to do, and then you can move forward to your client consultation. One thing to note is I wash my hands upon arrival. I would be washing my hands again before I greet my client. I'm just going to grab a sip of water here, but I'll be washing them again before I start the service. So I just want you to know that approaching my client, I would always approach my client with clean hands. So we're going to greet our client now for that client consultation. She's arrived promptly at her time. We're going to escort her to the work area. We're going to determine the client's preferences, and we're going to assess the client's needs. We will assess the client's skin by performing a skin analysis, and of course right now we can just do that with our eyes while we're having a conversation. to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We're going to assess the client's consultation form for any medications and products used within the last 72 hours, and we're going to consult on any known allergies. We're just kind of brushing over this, but I'm going to talk about it a little bit more in detail in a minute. We're going to consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care, we'll assess if the client is prone to cold sores or fever blisters. We will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from the above, we can move forward with the procedure. So, a couple things to note. The client consultation is incredibly important. You don't want to skip over anything here. So we're going to really take our time to get to know our client if we don't already, and just discuss a few important key details. Of course, one of the reasons that we ask about any allergies, known allergies, is we don't want to use a product that might have an ingredient in it that they are allergic to. That's critical. We also want to know anything that they've taken or used within the last 72 hours, because medicine can affect the skin, potentially making it more sensitive, just like anything that they've used on top. Like we talked about alpha hydroxy, beta hydroxy. We don't want to have any kind of increased sensitivity, and we don't want her to be using anything that could potentially be also thinning to the skin. Even though we're doing a basic facial, we need to make sure that there's no danger. We're going to make sure that they do not have, at the current point, any cold sore or fever blister or prone to. If there's anything at all current, they obviously will not be given the service. It's highly contagious, and you would never perform any service on anyone with a cold sore or fever blister. And once again, we just make sure that they don't have any kind of injections like what we talked about, or filler. We would have to wait to do the facial. So our client, thankfully, does not have any contraindications, and you can kind of talk about on and on a lot of different things. They're like high blood pressure, diabetes, so many things across the board. But that's how you get to know your client, and it's really important that you're notating all of this in your client card or software system, whatever you use for your client. So luckily enough, our client is great, ready to go. So we're going to allow her to have some private time to change into the drapes that we've laid out for her on the facial bed, and then we'll come back and knock on the door when we think it's been long enough for her to lay down and get comfortable, so that we can make her more comfortable. So our client is disrobed. We've been able to come back in. We're going to help tuck her in on the facial bed. We've got our headband here that we're gonna keep her hair out of her eyes and off the face. So we're gonna put her headband on, and you could certainly use a hairnet, anything that you think would be great for that client. And then we have a nice rolled towel that we're gonna help support the neck with. We're gonna place that under the neck for additional support. And then, of course, we've got the extra towel to lay across the décolleté, just protecting anything else if we need that to be there. So that being said, before we start, I'm going to wash my hands again. So I'm going to go to the sink, wet my hands, get that coin-sized amount of liquid hand soap, and I'm going to wash my hands together down to the wrists. I'm going to wash the back of my hands down to the wrists. I'm going to be washing my fingers, and I'm going to wash, of course, the backs of my fingers. I'm going to wash my fingertips and nails. And I'm going to wash my thumbs. I'm going to wash between my fingers. I'm going to wash between my fingers and my thumbs. And I'm going to wash my wrists. And I'm going to do all this really good wash for a minimum of 20 to 30 seconds. And then I'm going to rinse thoroughly underneath the running water. Once I have that good rinse, and I feel like everything is clean, I'm going to grab either disposable paper towels or a towel, and I'm going to turn the faucet off. I'm going to dry my hands thoroughly, and I can throw the paper towels in the trash, or I can put a towel that's now dirty into a closed container with a lid until it's time to do the laundry. And then last but not least, I find my hand sanitizer that has 70% ethyl alcohol, and I sanitize my hands. And once that's finished, we can begin the service, which is for the basic facial. So the first thing that you want to do is remove any makeup. So that's what we're going to do to start. And clients like all different kinds of makeup. So some clients will wear makeup, some clients won't. So just take your time here and do what you need to do to remove what you need to remove. And then we're gonna do our first cleanse on our client. So I'm just gonna get some cleanser. And then I'm just gonna remove that first cleanse. Excuse me. Just need to finish drying here. And so at this point, what you're going to be doing is the proper full professional skin analysis. So what we're going to do is we're going to cover our client's eyes because we're going to use a magnifying lamp or Woods lamp. So we're going to tell her we're getting ready to use a really bright light. I'm actually going to do one other step with this as well, and I'm going to bring in a Foursquare just to give it some extra coverage. And then, you tell your client you're bringing in a bright light. I don't have one, so I'm just going to bring in my magnifying lamp and I'm going to turn it on. And then what I'm going to do here is I'm going to take some time to look through that magnifying lamp and really analyze the neck, the chin, the cheeks, the forehead, around the eye area. I'm really taking my time here to look at the skin, and there's tons of reasons that we want to do this. Number one, maybe in your client consultation, you've discussed some specific goals that you and your client are going to be focused on achieving, or her main concerns for coming to see you and what she's really looking to focus on. Maybe she's dealing with, because winter's coming, surface dehydration or flakiness, or maybe she feels like she's looking like she's got some premature aging. She doesn't look as good. She wants more of a glow. Maybe she's worried about hyperpigmentation. Maybe she's a complete opposite and that she's breaking out and she's got excess sebum. There's so many things that we could be discussing here. This is where you go off your consultation and then you get in here and really analyze. So obviously in different parts of the face, we're looking for different things, but beyond just the basics, like how you can make her skin super amazing or his skin, you're also trying to learn your client's skin and learn all the details and nuances, from every freckle to every mole, to where you can start to track improvements or regressions. Any change at all in any kind of a mole or freckle would be a concern, and you, being their skincare professional, may see it before they do, and maybe if it's out of your scope of practice, you can refer them to a physician. But other than that, you're also going to want to be able to really drive her towards, or him towards, a really supportive home care regimen outside of what you do here, because they're at home more than they are with you. And all of this work that you guys are putting in, all the money that they're investing by coming in for services, you want them to be able to see their maximum benefit and result, and that is going to be through not only what you do here, but day-to-day skincare and routine. So you're really driving those points home as you're walking through each step, but this is the step where you can really take a look at the skin to say, hey, I think these are the things that can make a difference, and then you can communicate that to your client. So once you're done with this proper professional skin analysis, then you can turn that magnifying lamp off, take it out of the way, and then remove the eye coverage, and then you can go back to your cleansing. So now what we need to do is cleanse number 2. And the goal here is, of course, to remove any additional makeup, dirt, or debris. That's your goal. And then we're going to remove cleanse number 2. And then, excuse me, what we're going to go in there and do now is that third and final cleanse. And sometimes you may not need to do the third cleanse, but this client we need to. And with all of our segments of this basic facial, we will always be avoiding the eyes, the nose, and the mouth. And so now we are going to remove this third and final cleanse. Once you finish with that third cleanse, you're going to tone. And so I'm using a spray toner, so what I'm going to do is make sure with my 2x2s that I keep them away from touching the nozzle of my sprayer, of course, which I will, just keeping it just nice and sanitary. That never touches, they never touch each other, so excuse me. We are going to come in and tone. And so now that we have toned, it is time to exfoliate. So I'm going to get about a pea size amount of an exfoliant, and I am going to just spread it out over my client's face, just a little bit here and there, because I'm gonna massage it in. And of course, we're gonna follow manufacturer's directions on this, but I'm gonna be massaging in her exfoliant for anywhere from 1 to 2 minutes. So you just wanna read those manufacturer's directions always, be mindful about that. And then there's 2 kinds of exfoliants. There's a physical and a chemical. So just read what you're going to be doing there, and then we'll move on to the next step of the exfoliant. Always want to read and follow directions. Of course, we are avoiding the eyes, the nose, and the mouth, like always. Once you've gotten that exfoliant massaged in, you're going to move forward, and I'm going to read through the next part of the process because I don't have the equipment, so I just wanted to let you know, go over what's happening. So you're going to retrieve that steamer, you know, the one that we pre-prepared with distilled water, etc. And you're going to turn it to the on position and position the steamer next to the facial bed, making sure that it is facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, you can position the steamer about 16 inches over the client's face, aim it at the client's chin for even distribution on the face, and allow the unit to function for 3 to 5 minutes. Remove the steamer from the client's face, return the steamer to its previous location for disinfection. So we're gonna bring that facial steamer over, turn it on, and make sure that where it emits the steam isn't facing our client. Once it warms up, heats up, and everything is smooth and dandy, we're going to position it over the chin towards the client's face, and we're going to let it do that mist for 3 to 5 minutes. Now, obviously, we're making a video, we don't have the equipment, so we're going to pretend like 3 to 5 minutes has passed. We're going to turn it away from the client, turn it off, return it to its original location until we can disinfect at the end of the service. So we have done all of that. The time has elapsed in our video world, and what we're going to do now is we are actually going to grab from our hot cabbie, which I don't have that either, so we're pretending, a nice hot steamy towel, and we're going to shake that out. And then I'm going to check the temperature of the steam towel on my wrist to make sure that it's appropriate, and also on my client's collarbone. She feels good with it, so I'm able to lay this hot steam towel on the client's face. I'm going to leave the nose out so she can breathe, and I'm going to give it a nice light press. And you have about a good, 20-30 seconds until you start to feel that towel cool down. When it starts to cool down is when you want to remove it. So you're going to let it sit there for a minute just to have that nice steam action. Of course, we've also used the steamer. And then once you start to feel that gradual cool down, you can then remove your exfoliant. So we're going to use this nice steam towel to actually finish removing it. And then make sure that you get your hands nice and dry, because this is the point of the facial that you would be performing extractions. My client does require just a few extractions. Her skin looks really, really good, so we don't need to do a lot, but there are a couple, so I'm just making sure that I'm getting my hands dry before I try to put on disposable gloves, because if they are not dry, the gloves are going to be incredibly difficult to put on. And once your gloves are on, you can perform your extractions. So let's talk about that. You could use 2 cotton rounds soaked in astringent, and you could wrap them around your fingers and then perform your extractions and work your way around the cotton rounds and then toss the dirty cotton rounds in your gloves. I'm actually going to use the wooden stick removal. So we're going to soak these wooden tipped Q-tips in astringent, and then we're do an extraction, and then we're going to toss them, and we're going to do another extraction, and we're going to toss them. So we're really working our way around. And she just has a little bit of congestion on her chin. She doesn't normally have it, and I think it's just due to mask wearing. We've seen a lot of what we call mask knee, or people breaking out around that area that don't usually, and it's because they are obviously having to be long hours in a mask, but we are thrilled to do what we have to do, obviously, to get to the next place. So we're just going to deal with it. So we are performing extractions and then tossing those Q-tips that we can't use anymore. And one more. And we're all done with extraction. So we can go ahead and remove our disposable gloves and toss those as well. So we've exfoliated, we've extracted, which means now we are going to tone after we do our extractions. We've got 2 of our 2x2s, and we're going to take our toner and we're going to hold it away. And her skin already looks just awesome. Just awesome. She's going to be thrilled. We got the little bit of congestion on her chin, and we're getting her nice and exfoliated, hydrated. She was worried about being dehydrated, so she's going to be really excited. So after all that toughness, and mind you, you would not want to do extractions for any more than 5 to 7 minutes, as it can be painful sometimes for some people. So you don't want to linger in the pain part for too long. You want them to also be able to have the calming part. We're going to step into the massage. Now, if someone had severe acne, we would not be doing a lot of massage. We wouldn't be doing any of this that we're getting ready to do. So just note, based on your client, what you would be doing at different times. So we're going to get our massage product, and making sure that we get enough of our massage product before we start the massage. That way our hands do not have to leave our lovely client, and he or she then would get that full relaxation time. So that's kind of a key thing to keep in mind, is that once you get that massage product, when you are setting up here for your massage time, go ahead and make sure that you have enough on your client or spread out on your client before you get started, so that you're not having to go back in and retrieve more product. It just allows the client to truly have that beautiful relaxation time. And then you would remove the massage product, of course. And then after you remove your massage product, you are going to apply a mask. So I am going to use a brush to apply my mask, and just like everything else, we would avoid the eyes, the nose, and the mouth. And then, of course, you're going to always follow those manufacturer's directions for your mask. Like everything else. And based on the skin type of the client, the mask that you're using, all of those things go into play with your timing. So we're going to say that this mask you could leave on from anywhere from 5 to 10 minutes once you've applied it. So you figure that out based on what you feel like your client needs or can handle. And because obviously we're doing this for video, we're not going to sit here for 5 to 10 minutes. So we're going to say that whatever is appropriate for her, somewhere in that range of 5 to 10 minutes has elapsed. And so then we can go ahead and remove that mask product. her skin looks awesome. So we know that she's going to be super duper satisfied with the results of this facial, and it isn't, like we said in the beginning of this video, an existing client, so we're just pushing, marching towards those goals that we're working on. She's being consistent at home. We're going to be adding in a few more things in to her home care routine today, but she's seen a big difference with these services as well. So once you're done with your mask removal, we're going to go to our final toning of the client's skin. And then, of course, it's the daytime, so we're going to be applying an eye cream and an awesome moisturizer with a sunscreen. We also can apply a little bit of a vitamin A serum if that's what she wants. We're just going to take a super, super duper duper small amount of eye cream, and we're going to apply it with our ring finger. It's the most delicate finger, so we're going to hit that zygomatic arch, and we're also going to hit the brow bone, light taps. And we're going to get that day moisturizer with Physical Block. We're making sure that we've got some really, really good SPF. And actually, that's one thing that she is going home with today is a new hydrating moisturizer. She was using the matte one during the fall and the summer, and she's just feeling really dry. So we're going to switch it up into that more moisturizing one with some sunscreen, which we know she's going to be thrilled with, and we're going to make sure we get any area that might be exposed with the SPF. And we're changing up her night cream as well. It's going to have a little bit more hydration and a little bit of an exfoliating power to keep the dead skin off as much as we possibly can in between visits. And then, of course, we're going to give her a little lip balm because everybody wants the lips hydrated as well before we present the skin. She'll be so pleased. And then we would present her skin, and she looks awesome. So now it's time to give her that privacy so that she can get dressed, and we can meet her to check her out and get her booked for her next appointment. So we'll give her those few minutes. We're going to ask her to meet us in that client consultation area to review any maintenance and aftercare, and to discuss those products she's going home with, and then go get her checked out because we're going to go ahead and get her booked for her next appointment, because we have a process that we're doing and we have some goals that we're trying to achieve before Christmas comes, and we still have a few weeks to do that. So we've got a whole month, so we definitely have time to get a service or two more in before the holidays. So after that, we're going to go get her checked out. Obviously, she's taken care of. We are going to get back to our room because we've got another client coming in for a facial, so we need to get set up. And the first thing that we do when we get in that room is we look for any single-use items that maybe we didn't discard, and we're going to go ahead and toss them in the trash. We're going to take all the linen that we just used, and we're going to place it in a closed container until it's time for laundry. We're going to get any implements that we've used, and we're going to put them in a closed container labeled to be disinfected. And then we're going to identify and find a proper cleansing agent. We're going to read and follow manufacturer's directions on mixing and usage, and then we're going to completely wipe down our workstation and area, removing any dirt or debris. We will then identify a disinfectant that is bactericidal, virucidal, fungicidal, an EPA approved for use in a salon setting, which means we need to get another pair of disposable gloves, put them on before we even think about mixing that, following those directions. We will get that done, and then we follow the manufacturer's directions for mixing in or using appropriate aerosol disinfectant, and we will disinfect electrical equipment, store it in a clean area separate from other implements, and then to finish it all off, we need to wash our hands. So we're going to head over to the sink, wet our hands, get that coin-sized amount of liquid hand soap, wash our hands down to our wrist, wash the back of our hands down to our wrist, wash our fingers, and wash the backs of our fingers. We're going to wash our fingertips and nails. We'll wash between our fingers and our thumbs. We're going to wash our thumbs. We're going to wash our wrists. And we're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. Then we're going to thoroughly rinse our hands underneath that running water. Once you feel like they've properly been rinsed, you can grab either disposable paper towels or a towel. You're going to turn the faucet off with the towels, dry your hands completely, toss the paper towels in the trash. If it's a towel that's now dirty, it'll just go in that closed container with the other dirty laundry until it's time for laundry. Grab your hand sanitizer, 70% ethyl alcohol. Do all of that proper movement that you've been working on when you washed your hands with your hand sanitizer. And you'll know at this point that you have completed what you need to do, and you can go ahead and begin the setup for your next client who's coming right in for a facial. So that concludes this basic facial video.